Hi, everyone. I'm excited to talk to you about communication strategies from the standpoint of a professional. As a healthcare professional, you may have patients who have hearing loss. You may also have colleagues or family members with hearing loss. How can you communicate with them effectively? How can you help them advocate for themselves and for their communication needs? In this presentation, I'm going to share tips and strategies that I have learned from my personal and professional experience as an audiologist who is deaf. I'm going to use the acronym IMPACT to help you remember these tips and strategies. So the first letter of IMPACT stands for invite. Invite your patients to disclose their hearing loss and their communication needs. You can ask, do you have any difficulties with your hearing? If they say no to this question, it is possible that they have hearing loss, but they are not aware of it. The beginnings of hearing loss are very subtle. You can also ask, do you experience ringing or buzzing in your ears? An important sign of hearing loss is tinnitus. 90% of people who have tinnitus also have hearing loss. You can also use some cues or signs of possible hearing loss, such as they may talk too softly or too loudly. They may respond inappropriately or off topic, and they may have a blank look on their face when you're speaking. Disclosing communication needs is just as important as disclosing hearing loss. Many adults with hearing loss need support to communicate what their needs are. Typically, these skills are not explicitly taught and can be a bit tricky to navigate because when people advocate for their own needs, they have to ask other people to change their behavior. Most adults with hearing loss are not experts in behavioral science. To make this easier, you can ask, what can I do to make communication easier for you? A common pattern is that a talker will speak louder or slow down for the first part of a conversation after the person with hearing loss has disclosed their communication needs. But then the talker soon after reverts to their normal and familiar way of speaking. To safeguard against this, encourage them to tell you at any time when they're not hearing or understanding. And reassure them that you are willing to accommodate. For example, if there's something that you don't hear or understand, please don't hesitate to ask me to repeat it. I don't mind at all. I just wanted to tell you what it's like to be on the receiving end of, I don't mind at all. Because so often people do mind, and it's communicated through their nonverbal body language. And I get that sometimes it can be frustrating to talk to someone who has hearing loss. So when you use these words, I don't mind at all, your kind words can be just as healing as any treatment that you provide. To illustrate the importance of inviting, I'm going to share a story from one of my group classes on hearing strategies. In these classes, we discuss bluffing, which is a common behavior in people with hearing loss. Bluffing means pretending to understand when you really haven't. The homework assignment for this class was to notice when you're bluffing and stop yourself at least once. In the next class, a student I will call Anthony spoke about the homework. He described a situation where he, his wife, and the local nurse were preparing for a telehealth conference with his cardiologist. Anthony was having a hard time hearing the nurse as she was setting up, and her back was turned to him. As so often happens, the nurse started to address her comments towards his wife instead. Anthony made what was for him a bold move. "Stop," he said. "Talk to me. This is about my health. I may have some difficulty hearing you, but this conversation should go through me." Everything did stop. He felt a ripple of tension in the room. But from that point on, everything in the conversation was paced and directed by his communication needs. Anthony's homework brought to mind two important points. First, Anthony was infinitely better off disclosing his communication needs rather than to let the nurse make some incorrect assumptions about his cognitive health. When our conversational partners notice we're not following the discussion and responding appropriately, they begin to draw their own conclusions. In the absence of information about hearing loss, others can form a wide range of misperceptions, including we can't follow or keep up because we're not with it. Anthony is not only with it, he's very knowledgeable about his own health. Secondly, Anthony's image of himself changed. If he had allowed the telehealth appointment to proceed with his wife doing all the talking, he would have left feeling, "I can't do this without her help. I have become someone who can't manage by myself at a medical appointment." A feeling of powerlessness would surely follow. Instead, because of a small commitment to stop himself from bluffing just once, he came away with a different story about himself. "I'm still responsible for my own health and my own communication needs." In short, Anthony advocated for himself. What about people with hearing loss who don't have these skills? This is more the norm. As mentioned earlier, the beginnings of hearing loss can be very subtle. Day by day, the change is barely noticeable, but over a period of years, the change can be significant. Among adults who have hearing loss that is not medically treatable, meaning that they are hearing aid candidates, only 40% of them wear hearing aids. Research tells us that people with hearing loss adjust to their hearing loss long before they acknowledge that the hearing loss exists. Research also tells us that approximately 2/3 of these adjustments are maladaptive. Two common adjustments are bluffing and withdrawing. Both strategies are problematic in that they can affect relationships, communication, and ultimately health and well-being. I'm telling you this because many people with hearing loss need support to advocate for themselves. It starts first with disclosing their hearing loss and their communication needs. Knowing that your patient has hearing loss is also important because hearing loss is linked with other health conditions. For example, hearing loss can increase your risk of developing depression and anxiety. The risk of dementia is higher in people with untreated hearing loss. With moderate untreated hearing loss, the risk of dementia is 3 times higher. In fact, hearing loss is the biggest modifiable risk factor for dementia. It's modifiable because if the hearing loss is treated, risk is reduced by 48%. In addition, hearing loss is 2 times more common in people with diabetes. Adults with hearing loss are 22% more likely to be hospitalized. Hearing loss is correlated with reduced mobility and a 3 times greater risk of falling. Kidney disease is related to a 43% greater risk of hearing loss. And hearing loss has links to cardiovascular disease in that they are correlated. The second letter of IMPACT stands for Make Your Face and Lips Visible. This means that you should make sure that your patients can see your face and lips clearly. Many people with hearing loss rely on visual cues such as lip reading, facial expressions, and gestures. Visual cues also convey emotions and intentions that may not be captured by the voice alone. If they are not looking at you, get their attention before you speak. Important cues about the topic and context are usually in the first few words of what you say. If they miss the first few words, they may spend the rest of the time trying to catch up and figure out the topic. Avoid obscuring your mouth. Do not cover your mouth with your hand or anything else. If you need to use personal protective equipment or PPE, consider using a clear mask or face shield, or remove your mask for the conversation. Face the person with hearing loss directly, not the significant other or family member, as with my story about Anthony. It's hard to read your lips if your face is in profile or at an angle. Maintain eye contact and avoid looking away or turning your head while speaking. If the patient uses a sign language interpreter, look at the deaf person when you're speaking, not at the interpreter. As much as possible, stop talking when you look away. The third letter of IMPACT stands for pause and speak slowly. Speaking too fast can make it difficult for people with hearing loss to follow the conversation. Pausing between ideas can give them time to think and respond. The pause is important because of the listening effort involved. A greater effort will require more cognitive processing power, and we all have a limited amount of cognitive processing power. People with hearing loss expend a lot of cognitive processing power just trying to figure out what the person is saying, particularly if the person is wearing a mask or if the vocabulary is unfamiliar. As a result, processing speed is going to slow down. A week later, a person with hearing loss may not remember the details of a conversation because the details never made it into their memory bank. And memory can only be as clear as its original signal. A pause between ideas gives them time to think and process. Linking back to the blank look on the face as a sign of hearing loss, this happens because so much cognitive processing power is being used to figure out what you're saying and process it, that the person may not have any cognitive resources left to be expressed on their face. If you see a blank look, you may assume that there's lack of emotion or a cognitive deficit. However, it might just be that the person is still processing and a pause is needed so that they can catch up. And I know this from personal experience, as you can see in this photo. This is me in my 20s, before I had my cochlear implant, and the listening effort was very high. And I remember this specific moment because I was so happy to be talking to my cousin. It was a family reunion, and our family is so big that they actually had to rent a community hall for all of us to get together. But the noise levels were really high, and I was having a hard time following the conversation. So I was so surprised when I saw the photo at this blank expression because it does not reflect what I was thinking inside. The fourth letter of impact is arrange. This means that you should arrange appointments and spaces in a way that facilitate accessibility. To arrange appointments, it's very helpful to use text messages, emails, websites, or apps to schedule and confirm appointments with your patients who have hearing loss. These methods are more accessible than phone calls for people with hearing loss who have difficulty on the phone. To arrange spaces, you should reduce the distance between you and your patients to a distance of 2 meters or less. The microphones of hearing aids and cochlear implants have a circle of sound of about 2 meters. Outside of that 2-meter circle, the microphones of the hearing aids and cochlear implants are not capable of delivering the high-frequency sounds. Sounds such as S or SH or CH, they can carry a lot of meaning in English, and they are very soft and don't carry well at distance. Next, arrange your space if possible so that your face is visible while you're working. If you do have to look away to type or do other things, the person with hearing loss may not understand that part of the message or have to work harder to get it. If it's not possible for you to arrange your space to do this, if possible, stop talking when you look away. Some people with hearing loss use a remote microphone to transmit your voice directly to their hearing devices. If you are asked to use one, rather than hold it in your hand, it's preferable to clip it onto your shirt collar about 6 inches from your mouth on the neckline. It's also helpful to provide written materials, handouts, or summaries that can supplement or reinforce what you're saying. The fifth letter of impact stands for confirm. Confirm understanding that so that you can assure that there's no misunderstandings or errors that can arise from a communication breakdown. To confirm understanding, you should avoid yes/no questions, such as, "Do you understand?" These questions can be easily answered with a yes without revealing what the person actually understood. They also put pressure on the person to say yes out of politeness, fear, or embarrassment, even if they don't understand. Use open-ended questions such as, "What questions do you have?" These questions can elicit more informative responses that can reveal whether a person understood what you said. Open-ended questions also invite the person to share their thoughts and concerns about the topic. Pay attention to any facial expressions or body language that may indicate confirmation or lack of it. It's helpful to restate key points in small chunks and use a simple hand signal like a thumbs up or thumbs down with a questioning look for quick confirmation. After conveying important information, offer an opportunity for clarification by saying, "Please let me know if you have questions or if there's anything that I can clarify." And you may have to do this more than once. The last letter of impact stands for 3 times you're out. That means that you should avoid saying something more than 3 times. That seems like a lot, doesn't it? But if someone says pardon and you repeat, you've already said it twice. It's not all that uncommon if you know someone with hearing loss to have to repeat again. 3 times needs to be the charm. You don't want to have to say it a 4th time, and neither does the person with hearing loss. To illustrate the importance of applying the 3 times you're out rule, I'll share another example from my group classes. As mentioned during the class, we discussed bluffing, and I gave them the homework assignment of observing why and when they bluff. A week later, when the class reconvened, one of the class members said, "I had no choice. What could I do?" I said pardon 3 times, and I still couldn't hear. It was getting pretty embarrassing, so I bluffed my way through it. He's right, it does get pretty embarrassing. And chances are the person doing the repeating is not too happy either. But when someone repeats exactly what they've just said in the same way a 3rd time, chances are it's not going to get better. So instead, you can try to change something after the 2nd attempt. You can say it a different way. Change your volume, speed, or emphasis. You could also use gestures to support what you're saying. You can rephrase using different words that have the same meaning. Use synonyms or examples. If you said the weather is chilly today and they didn't understand, you could say it's cold outside. Breaking your message up into smaller chunks is really effective. So for example, if you said, your appointment is next Tuesday at 10 a.m. and it wasn't understood, you could say, your appointment is next Tuesday at 10 a.m. or 10 in the morning. Give context for what you said by providing some background information or explaining why it's important. You can use transitional words such as because or example to signal that you're giving context. If you said, you need to take this medication twice a day, and the person did not understand, you can give context such as, this medication will help lower your blood pressure. You need to take it twice a day because it works better when it's spread out over time. In this presentation, I wanted to focus on the positive, on the things you can do, but there's also a few things that you shouldn't do. And there's a new acronym for that. It's called SICK. The first one's not likely to happen in a professional interaction, but it could show up in a relationship with a colleague or outside of work. The S in SICK stands for don't say never mind. If the person with hearing loss is not understanding and you say never mind, it can feel really dismissive and it hurts. The Y in SICK is don't yell. When you talk very loud, only the vowel sounds get louder. Most of the consonant sounds don't get louder. Try yelling a TH. Talking loud can distort your face and make you look angry, and that can make it difficult to read your lips. I have disclosed my hearing loss, and the professional has talked so loudly that it feels like I'm being yelled at. Being on the receiving end of it is not pleasant because I stop listening. I'm thinking, why is he yelling at me? Gosh, I hate being yelled at. If you're not sure, check with the person. But it's best to speak a bit louder and speak from your chest rather than your throat. But also face the person and pause between ideas. That will make a huge difference. The C in SICK is don't call their name to come in from the waiting room when you're more than 2 meters away. If the person discloses their hearing loss, Staff who call them from the waiting room should be aware they can wave or somehow get their attention so they don't miss their name being called. Any nonverbal way of getting their attention will work. Sitting in a waiting room, especially if it's a long wait, on the edge of your seat, waiting for your name to be called, can be a stressor before you even get into the actual appointment. A point of interest is if you're not sure of how to say a name as a professional and you're standing in front of a room full of people who are looking at you, you might not say it very loud because you feel unsure. Also, mispronunciations of names can be difficult for a person with hearing loss. So not only do they need to be alert for their name, but all the phonetic variations of it. So in this presentation, I have shared with you some tips and strategies that I've learned from my personal and professional experience as an audiologist who is deaf. And I have used the acronym IMPACT to help you remember these tips and strategies. IMPACT stands for invite your patients who have hearing loss to disclose it and disclose their communication needs. Make your face and lips visible. Pause and speak slowly. Arrange appointments and spaces in ways that facilitate communication. Confirm understanding. And the 3 times you're out rule. You can have such an impact on the outcome of interactions with people who have hearing loss. You can find me on Instagram and YouTube, and I would love to connect further. Thank you for your interest in learning more about communicating with people who have hearing loss. Bye for now.